oxygen as a nutrient far more so than I look at it as a drug or a treatment of disease. And as we increase atmospheric pressure, we're able to drive more oxygen into the cells. What we're doing with hyperbaric is we're filling red blood cells. They'll be 100% saturated. So now it becomes a reservoir of and a surplus of oxygen far beyond what's possible under normal circumstances. Every athlete knows that oxygen is critical for their performance. Hyperbaric's going to help you carry more oxygen. It's a way of really flooding the system with oxygen, and that could have an incredible performance capacity to it. A lot of athletes struggle in performance because they're either overtraining or just under-recovered. Hyperbaric has a long-standing evidence of really supporting the recovery process. Ligaments, tendons, discs, these don't have great blood supply. If they don't have good blood supply, these are notorious for taking forever to heal because we don't have the oxygen flow to really stimulate the recovery. And hyperbaric is so critical for pushing oxygen into those, through those barriers to really stimulate that healing and recovery.
If you could, we're just going to kick things off right here, Dr. Soners. If you could tell us about HBOT and how you got into it.
Sure. So I got into it as a personal journey, actually. So I had a back injury that led to drop foot in my right leg. So some nerve damage from a herniated disc. And, as a chiropractor, that's just not good for business. And, my wife's a chiropractor too. So she was treating me and, the back issues got better pretty quickly. But I was left with nerve damage for at least 18 months or so post the original accident. And I actually happened to be at a conference and they had chambers. I didn't know what they were, but I looked interesting. So I gave it a shot. And it was in the first, about 10 minutes or so after that first session, I started getting pins and needles in my foot. And it was the first time I actually felt my foot for 18 months. And I thought, wow, is this happening because of that, that chamber I was just inside? And, sure enough, it was. And so after a few sessions at that conference, I decided to buy a chamber, treat myself. Had no intention of ever really offering it in my office or to my patients. It was just like, I needed this for me. But once I saw how effective it was, I pretty quickly started using it and, running it in the clinic. And then actually we built a whole separate hyperbaric clinic, as part of the office. It was a pretty incredible journey for me.
What is hyperbaric oxygen therapy doing for people with a lot of the people you work with now that you are applying it to patients?
So, the real key here is that the oxygen follows pressure. Even right now, you and I were surrounded by an atmosphere. That atmosphere has a pressure, and that pressure is what allows you and I to even extract the oxygen from the air that we're breathing right now. We've all had an experience where we go up in elevation, hiking or a mountain or, go to Colorado or something. It feels harder to breathe. And we say there's less oxygen, but it's not so much that the percentage of oxygen has changed at all. It's really just that there's less pressure at elevation. And so we absorb less oxygen because of that decrease in pressure. Hyperbaric is the exact opposite of that. So we're temporarily increasing atmospheric pressure. And as we increase atmospheric pressure, we're able to drive more oxygen into the cells. Even if it's just air, like breathing air at pressure is still going to drive a considerable amount of oxygen into the cell. If we add additional oxygen to that, it becomes a multiplying effect. But, essentially, other than red blood cells, which are the cells in our body that carry oxygen to deliver it, they don't use oxygen. They don't have mitochondria, but every other cell in your body has a mitochondria, needs oxygen. And what we're doing with hyperbaric is we're filling red blood cells. They'll be 100% saturated, but for you and I, if we're relatively healthy, we're almost 100% saturated as it is. So what hyperbaric does beyond any other therapy as far as oxygen goes, it bypasses red blood cell carrying capacity and actually starts to fill the plasma with oxygen. The plasma usually doesn't carry much oxygen at all. And so now it becomes a reservoir of and a surplus of oxygen far beyond what's, possible under normal circumstances. And that's the real, quantity of oxygen that hyperbaric, is able to do to create, the healing and recovery and regeneration that hyperbaric does.
So overall, because we see a lot of NBA players, NFL players, we see a lot of coaches doing this for these athletes when it comes to recovery. So systemically, what are some of the benefits that it can cause to anybody, but for someone who is stressing their body out in athletic, endeavor?
So there's for me, when I talk about or think about the athlete, by by the way, I mean, my background before I was, I did exercise physiology before that and nutrition before that, and, then chiropractic, and then, sort of got into, hyperbarics and then teaching hyperbarics. But, I look at oxygen as a nutrient far more so than I look at it as a drug or a treatment of disease. And so, the way I view for most in athletic world, it's two prong. One, every athlete knows that oxygen's critical for their performance. And you see athletes all the time, making decisions, some healthy, some maybe not, some legal, maybe some maybe not, but there's always this attempt at like, hey, I mean, that's what blood doping is, right? Blood doping is all about increasing red blood cell capacity so that we can carry more oxygen. Hyperbaric's going to help you carry more oxygen, and it's actually going to bypass the red blood cell carrying altogether. And so it's on a performance standpoint, it's a way of really flooding the system with oxygen, and that could have an incredible performance capacity to it. But I think, as you both would agree, and most athletes know, and trainers would know, is, performance is one component, but a lot of athletes struggle in performance because they're either overtraining or just under recovered. Mm-hmm. Which hyperbaric has a long-standing evidence of really supporting the recovery process. So for most, and you would utilize the tool differently in both of those scenarios, but for most of these athletes, I really try to structure a program of recovery first, because performance will increase as recovery improves. Everybody knows. And then once we got, a better baseline, then we could start, trying to use it from a, more performance specific standpoint.
Real quick, going back to what you were mentioning as far as like your personal nerve damage, because you said that, what you were doing with your wife helped your back and you still had that nerve damage. How did the hyperbaric chamber help you with that nerve damage, or did it?
Yeah. I mean, so literally that was my question. First of all, I was like, how did I get this far in my professional life and not even ever hear of what a hyperbaric oxygen chamber was? This is all, by the way, this is like 20 years ago, and so, why didn't anybody tell me? Like, why did I have to find this by accident? There wasn't like a clear, hey, nerve damage, hyperbaric, So what I realized was, especially in a lot of these injuries, and, any athlete has a history of injury, whether it's, brain injury or musculoskeletal, but, injuries that have healed, but maybe they haven't healed, quite as well as we needed them to. And so let's just use my case, because you brought that up. There are times when there are barriers to oxygen getting into the cell. Inflammation, toxicity, scar tissue, right? All these musculoskeletal components that could become a barrier for normal oxygen to be delivered. And so I had this disc injury, the immediate surrounding tissue healed and improved, but because there was still inflammation around the nerve in my back, it still showed up as nerve damage in my foot. And so it wasn't that even, I don't think that I needed any maybe additional oxygen to my actual leg or foot, as much as it became a driving force to push oxygen past those barriers of inflammation and scar tissue that actually allowed the nerve to heal at the root. And as the nerve healed at the root, the symptoms of the neuropathy, were able to improve. And that's the case, more recently, a couple of years ago, I had torn my shoulder, ligaments, tendons, discs, like these don't have great blood supply. If they don't have good blood supply, these are notorious for taking forever to heal because we don't have the oxygen flow to really stimulate the recovery. And hyperbaric is so critical for pushing oxygen into those, through those barriers to really stimulate that healing and recovery.
How much treatment would somebody have to do, and like how long? To maybe overcome something? I'm sure there's individual variants, but like someone go 3 times or 5 times, like how many times they need to go into a hyperbaric chamber to notice the positive benefits? So, yeah, I mean, what tissue is being affected? How long have I had that problem? How severe is that problem? How many repetitive injuries have I had to that same location? Those are all the, let's say the individual components. And then how much pressure am I using? What percentage of oxygen are we breathing? And then frequency and duration. So we have to understand, what the person's issues are and or what their, goals happen to be. And then what kind of equipment am I using? All of that would go into sort of a thought process of, protocol. But essentially what I would tell you is
I like to break these down into short-term and long-term changes and benefits. So short-term could happen every session or 5 sessions or less. So, right as soon as you start getting more oxygen, you get more ATP, right? More cellular energy being produced. That's very well known. And almost every session, you start to get some reduction of inflammation. Those things happen pretty quickly. But some of the other mechanisms like collagen synthesis, fibroblast formation, so like the stimulating the cells that will actually repair, let's say, soft tissue injury, or even bone, like there's osteogenic or like bone repair mechanisms that are stimulated through hyperbaric. A lot of those don't even start for the first 15 to 20 hours. So, this person's going to be using, let's say for my back injury, even though I started feeling changes almost right away, which, that's not everybody has that. A lot of people, it takes a few sessions before you even start noticing it. But, I essentially ended up doing closer to like 60 or 70 hours to get full recovery of that nerve. When I tore my shoulder, which was a pretty bad tear, which, by the way, thank you very much. I was using the slingshot as part of my recovery. I wanted to talk to you later about that, maybe if it'll come up. But, I probably did another 80 hours, for that shoulder in very, very frequent pattern to really recover from, with other things too, peptides and other things. But those long-term impacts, they take time. They really take time to heal. So it's a longer-term therapy.
This really changes the entire conversation now that we know that you lift and you know that you bench press specifically.
Well, so I had an impingement, like, I don't know, 8 years ago, and a guy that I work out, he's a great trainer, John Chipko. He uses, he's used your stuff for many years. And he said, he was working with me. I couldn't bench at all. I couldn't even get into the position. So we started using the slingshot for that. And then we used that once I got better, to really build into a much stronger lifts. When I tore my shoulder, it became literally an incredible component to my recovery from that. I'm both just regaining mobility, regaining strength. So I thank you really quite a lot for that.
I appreciate that. Are people like usually in these chambers for maybe like usually like around 20 minutes, like if they're going for a session? Because I imagine like just for like logistical reasons, like you can't have someone in there for like 90 minutes unless you have your own home unit.
So in my office, so I would say probably about 30 to 45 minutes is really the shortest sessions people do. But people do, I mean, whether it's at home or even in my office, I'd say most of our sessions are 60 minutes. We sometimes, if someone can't get in frequently enough, we might do 90-minute sessions just to make sure they get like a cumulative dose long enough. For performance components, shorter sessions seem to do great. So like those 30-minute sessions, like before a big lift or before a race, you'll see changes in short sessions like that. But for real healing, like if someone's coming out of an injury or a brain trauma, 45 to 60 minutes is very standard.
What can it do for the brain?
So, again, if we just look back at, let's say metabolism, I talk about cars a lot. I work on cars a lot. So cars need fuel and they need oxygen, and oxygen oxidizes the fuel to create power and heat, essentially inside the engine. It's a little more complicated than that, but essentially that's what it does. We all learned in like, 7th grade biology that the mitochondria is the powerhouse of the cell, but it's literally the engine of the cell. And so, we take in food, but we break that food into, the actual fuel a cell can use, which is essentially NAD for the most part, but we still need to oxidize it. So we bring in fuel and we have to bring in oxygen. And really we oxidize that fuel inside the mitochondria to produce energy. Our brain makes up only about 2% of our body mass, but it uses up almost 20 to 25% of all the oxygen that we breathe. So the oxygen demand of the central nervous system is incredibly high. So when you start driving 30%, 60%, 2 times, 3 times, 7 times the amount of oxygen, we start to get incredible cognitive changes in people, whether that's, neurodegenerative and we're trying to like heal a brain, but traumatic brain injury, longstanding concussions, That's, quite honestly, I think that's one of the reasons we see it growing inside of, a lot of like professional sports, especially, let's say, we're seeing a lot of it in MMA. We're seeing a ton of it in football. Even soccer, it's growing quite a bit. And I think a lot of that is just, trying to make sure that we're healing the brain so that we're not just getting all of those cumulative, concussion patterns that we're seeing. They're so consequential, especially for people, they might have had those, in college or even early in their pro careers, but then they have all these consequences, decades later. So, to try to ameliorate those consequences, hyperbaric's incredibly powerful for that.
Just kind of curious about this on the brain front. Have you ever noticed if people with extra oxygenation of the brain, do people think differently? Does it spur creativity? Like, is there any aspect of that, or is it just good at healing the brain from?
Yeah. So kind of like what we were saying before about, even athletic performance. You could use hyperbaric for brain recovery, like injury or disease, but you could also use it for brain performance. So, I speak a lot, I write a lot, articles, books, or creating talks. Like I do a lot of my creating and writing in the chamber because I have a very noticeable shift in my thought process, my processing speed, my creativity inside the chamber. So I do a lot of my brainstorming and thinking in there. And I think a lot of people, if they're doing it regularly and see that, would agree and also use it for that purpose.
All right, Mark, you're getting leaner and leaner, but you always enjoy the food you're eating. So how you doing it?
I got a secret, man. It's called Good Life Protein.
Okay, tell me about that.
I've been doing some Good Life Protein. We've been talking on the show for a really long time of certified Piedmontese beef, and you can get that under the umbrella of Good Life Proteins, which also has chicken breast, chicken thighs, sausage, shrimp, scallops, all kinds of different fish, salmon, tilapia. The website has nearly any kind of meat that you can think of. Lamb is another one that comes to mind. And so I've been utilizing and kind of using some different strategy, kind of depending on the way that I'm eating. So if I'm doing a keto diet, I'll eat more fat, and that's where I might get the sausage, and I might get their 80-20 grass-fed, grass-finished ground beef. I might get bacon. And there's other days where I kind of do a little bit more bodybuilder style, where the fat is, might be like 40 grams or something like that. And then I'll have some of the leaner cuts of the certified Piedmontese beef.
This is one of the reasons why neither of us find it hard to stay in shape, because we're always enjoying the food we're eating. And protein, you talk about protein leverage all the time. It's satiating and helps you feel full.
I look forward to every meal. And I can surf and turf,
Yeah.
I could cook up some, chicken thighs or something like that and have some shrimp with it, or I could have some steak. I would say, the steak, it keeps going back and forth for me on my favorites. So it's hard for me to lock one down, but I really love the bavette steaks.
Yeah.
And then I also love the ribeyes as well.
You can't go wrong with the ribeyes. So guys, if you guys want to get your hands on some really good meat, you can head to goodlifeproteins.com and use code POWER for 20% off any purchases made on the website, or you can use code POWERPROJECT to get an extra 5% off if you subscribe and save to any meats that are a recurring purchase.
This is the best meat in the world. There's many different types of chambers too, right? Like there's some smaller ones, but there's some units I've seen before where there could be a few people in there at a time. It's like maybe the size of like a large sauna or something like that, right?
Yeah. Yeah. So, there's soft chambers and hard chambers, like what the material's made out of, and that really dictates what pressure it can go to. So soft chambers are what we call mild hyperbarics, which is really how, like all that nerve injury and stuff, like that was all done in a soft chamber at mild pressure. When you get into the harder materials like steel or acrylic, you can go up much higher. So the soft chambers we usually measure it in what we call atmospheres. So right now, at sea level, I'm at 1 atmosphere. Soft chambers go to 1.3. So like 0.3, 30% more of an atmosphere. Clinical hard chambers can go up to 3 atmospheres. So 3 times the atmospheric pressure to what we're getting right now. You could fill these things with air, or you could fill them with oxygen. So what gas we're using to fill are different. And then they could be designed for 1 person, or they could be designed for 2, 6, 8, 12. There's a really beautiful facility in Florida. They have, it's a 48-person chamber. It's an incredible chamber.
This might be odd, but what does it feel like to be in a high atmospheric chamber? Like, do you feel like the air is different, or is it something that's unnoticeable, but the air is obviously different?
It doesn't most people, so the first experience is that your ears pop, just like an airplane is landing, So as the pressure's building, the only place most people will feel it is in their ears. And you just have to, like swallow, yawn, like the same thing most people would do when an airplane is landing, because you have to equalize that pressure. But it's kind of, in an airplane, takes off, you might feel some, pressure changes, but the whole time you're flying, you have no idea, but you're inside a pressurized machine. And you don't really notice it until it starts to land again. I would almost say the same thing in a chamber. You'll feel it for the first few minutes. You'll have to equalize your ears a couple times. But most people would say the entire time they're in the chamber, you don't feel the pressure on your body. You don't really feel any differences in the way that you're breathing or anything like that. If you were measuring, you would see that respiration rate goes down a lot. Heart rate goes down a lot. It's basically like a cardiovascular vacation, because you're getting so much oxygen. The body doesn't need to work very hard in order to oxygenate. So it's a very calming effect. The sympathetic nervous system, parasympathetic, like fight or flight, right? So fight or flight is like that stress response. The opposite of that is your parasympathetic. It's like your rest and digest side of your nervous system. Hyperbaric is very parasympathetic. Most people come out of a chamber just like, very calm, very relaxed. It has this, that kind of experience, but you don't really feel it from a pressure standpoint.
What kind of a percentage of oxygen are you usually going to? Again, I know it's going to vary quite a bit on someone's experience level and stuff, but I think our atmosphere is like 21% oxygen, I believe, right? And then you go inside one of these chambers, and is there any, like, do you feel any panic at all? If it's like too high or something like that, or is it still pretty calming no matter what?
Yeah, I mean, it's still really calming either way, most people would say. You could, like, when I first got into hyperbarics, it was a mild chamber, so 1.3 atmospheres, and I did air only, mostly because I didn't know anything else to do. That's just what I had, which is also partially why it probably took me so many sessions initially to get that response. But as an example, right now, if I put, a pulse oximeter on your finger, if you're pretty healthy, like it's going to say 98, 99% saturated, which means you don't have a lot of room for extra oxygen. If I gave you 100% oxygen right now at the surface, like you might get 1% or 2% because you have no issues in your red blood cell carrying capacity. If you go into a chamber, even if it's air only, let's say a 30% greater pressure chamber, like a soft chamber, even on 21% oxygen, you're still going to get about 30% more delivery. Because again, we're bypassing that whole red blood cell carrying. If you went to that same chamber and you were breathing, let's say 100% oxygen, you get almost 3.5 times the amount of oxygen. So it's incredibly large once you add enriched oxygen. For our office, as an example, if you're just very healthy and you're really just looking for optimization, for most people, I think that the mild chambers are more than enough. Like the chamber I have in my house and I've had for 20 years is air only and it's mild. I'm not really treating anything right now. When I tore my shoulder, I went to my office and I got higher pressure and 100% oxygen because I had a real specific issue that I was trying to solve for, and I didn't want to wait as long to get that response, right? So, what I would say is hyperbaric is mild all the way to pretty high pressure, and then from air all the way up to 100% oxygen. And our job is to try to figure out, based on your issues and your goals, what's the best pressure and what's the best percentage of oxygen. A lot of people, and you see this not just in hyperbaric, you see it in all of really healthcare, even exercise or other things. Like everyone thinks more is better, right? If this much is good, this much must be better. I'd say there's really there's a more specific formula to understand different tissues and different objectives should receive different pressures and different percentages.
With the fact that you're getting more oxygen, I would assume that probably people have attempted to breath work or psychedelics with this. We were having a conversation with someone recently who was talking about breath holds, and the cold plunge became very popular, and then people started doing Wim Hof in there, and then some people passed out in the cold plunge, and a few people died in the cold plunge. So my curiosity is there do people do breath work in the chambers, and is there any danger to any of that? Breath
That's a good question. Yeah.
Breaths, etc.
So the rule I would say is when the pressure is changing, so as you're pressurizing the chamber, right, the first 5 or 10 minutes, and when you're depressurizing the last 5 or 10 minutes, it's very important that you're just relaxed and you're breathing normally. When you're at pressure and the pressure is going to stay consistent and constant, you could do breath work and breath holds. And, I've done many. I've done Wim Hof, and I free dive. So, having longer breath holds is important to me. For people who do that, because you're getting so much oxygen, you can really shift your baseline of like, it helps you build your carbon dioxide tolerance, partially because you're getting so much oxygen inside that chamber. So, we've seen breath holds increase 2 or 3 minutes inside of the chamber versus outside. And then that helps them, even once they're retraining in from inside the chamber, that helps build those breath holds even outside the chamber as a result. But, so it is safe. I mean, a lot of people pass out with Wim Hof just because of that, that repetitive breathing and then that breath hold, but if you're in the chamber and that were to happen, you're in a really safe, high oxygen environment, but I would still recommend not necessarily trying to find that limit.
Mm-hmm.
Is the pressure almost related to altitude, or is it different than that?
Well, it's the opposite, right? So it's, altitude with going up in altitude, we're losing pressure.
I see.
Inside the chamber, we're literally mimicking below sea level. So it's most similar to scuba diving. It's like going below sea level, and increasing the pressure. That's really the acting driving force for the oxygen absorption.
I would assume that there are probably athletes who are using this before. I mean, you have to have quite a bit of access, but I would with what you're mentioning in terms of the breath holds, et cetera, I could see athletes using this before a game or before events. Is that something that's common?
Yeah. I mean, I think more and more, again, if they're ever asking for my opinion, they're getting a chamber and they're looking for, some advice, and I get brought into that conversation, I'm always trying to steer people into recovery first.
Gotcha.
Because their performance will improve as their recovery is improving. Mm-hmm. And if you do longer sessions, if you do 60 to 90-minute sessions, you sort of come out, I would say, too relaxed to compete. Mm-hmm. You really want that adrenaline, you need that excitement and adrenaline as you're getting ready for performance, which is why I typically recommend shorter sessions before performance. But definitely, endurance athletes, lifting athletes, we see a lot of shifting in capacity to do work, very quickly, session, competition.
What are you sometimes coupling this with? I would imagine, being a chiropractor, at your practice, you probably have many gadgets, devices, therapies. And
us well.
and things for people to do. So from a physical perspective, what are some things you are adding in? And maybe even from supplementals or supplements that could go along with this as well. Yeah. Something like methylene blue or something popping.
Exactly. Yeah. So, I always say the oxygen is just this foundational ingredient, right? Every cell is going to use it. If, again, what's the goal, right? So sometimes, let's say the goal is energy production, like mitochondrial changes. Well, hyperbaric is going to change mitochondrial function a lot. Methylene blue is going to change mitochondrial effect a lot. Red light therapy is going to change, so we often will stack, methylene blue in the morning and then red light right before a hyperbaric session. You're taking 3 of the rate limiting steps to energy production and you're just driving them full steam ahead. Take some NAD precursors in the morning or go in fasting. If you went in fasting, you're going to drive fat metabolism much faster in a chamber than you would outside the chamber. So, an NAD, methylene blue, red light, and hyperbaric oxygen is a mitochondrial dream, essentially. But if, let's just say, the goal was detoxification, hyperbaric helps upregulate a lot of our detox pathways, but maybe we'll mix that with some glutathione afterwards, or maybe with charcoal, let's say, afterwards, to really absorb some of the toxins that are being, pushed out. If it was tissue repair, I might use, shockwave therapy, hyperbaric, because hyperbaric's going to have like all these stem cell responses also. Shockwave is going to also stimulate some good repair and stem cell mobilization with a few peptides, Um, same thing with inflammation, red light's great for inflammation, hyperbaric's great for inflammation. I'll mix that with, maybe PPC 157 to really, another peptide to bring inflammation down. So, there's a lot of things that we could mix it with. And I try to choose, what combination is going to drive whatever pathway we're trying to achieve.
What does it take to own one of these in a home? I'm not sure about what some of these things cost, but over time, cold plunge pricing has gone down. More companies have cold plunges, so more people are being able to get them in apartments and homes. Same thing with saunas. You see saunas that actually fit in an apartment now. So when it comes to hyperbaric chambers, you were mentioning how some people wouldn't notice any type of change until 60, 70, 80 hours. So that would mean having to go to an apartment or
right. Well, they would see changes sooner, but sometimes to get the full, depending on how robust a person's problem is, they may do that many to get the full, the full blown recovery, let's say. Mm-hmm. But usually you would start to see changes 8 to 10, 10 to 12, that kind of thing. I mean, so I'd say the soft chamber market has been predominantly designed for home use. There's plenty of clinics that use soft chambers also. We did for many years and still do a little bit. And you can get a soft chamber for between maybe on the lower end, 10 grand. On the higher end, maybe you could spend up to 30 on a soft chamber. Mm-hmm. Hard chambers, have always been designed far more for clinical use, but, people who can afford it and really want it and feel that, the more is better, and they put a hard chamber, but hard chambers are 100 grand and go up from there. So it's kind of like it is a whole different animal. The soft chamber comes in boxes. You set it up in your apartment. You could put it next to your bed. It doesn't take up that much space. The hard chamber, you're almost going to want a room dedicated to it, Yeah.
Can you inform us about shockwave therapy? I've heard a lot of good things about that, but I'm not super familiar with it.
Yeah. So it's basically it's an acoustic sound wave. I think most people, it gets applied similar to what looks like ultrasound. So there's a wand and a gel, but it feels a little bit more like electric stim. There's a definitive electric sort of experience with it. It's a little bit, I'd say it's a little sharper and stronger than electric stim, but it's also a totally different modality. So what it does, not so much for pain relief or muscle spasm, but what it does is it stimulates a lot of growth factors, stem cells, and a lot of repair mechanisms. So for those repetitive injuries, sprain, strain, or tears of especially again, tendons and ligaments, things that don't have good blood supply. And this is something unlike hyperbaric where, for that tear, 40, 50, 60 plus hours, you only do maybe 6 to 12 sessions of shockwave in that over that same period of time. So it's something that's very powerful. It's relatively short acting. And again, in concert with some other healing tools like hyperbaric and peptides, when I tore this shoulder, you guys don't know me well enough, but I wouldn't get surgery for anything. For me to have to go get surgery would be there's nothing else as possibly, when I tore, it was a 75% slap tear and I tore 30% of my subscapularis. My arm was hanging. And I was within days, I was like, Melissa, I'm getting surgery. She's like, what? She's like, what would you tell a patient to do? And I was like, that's a good question. So, I made up I wrote up a protocol like I would have for a patient. And I followed it to a T. And I said, and I say this to all my patients, worst case, I go into the surgery as healthy as I could possibly go, which means I could only have a better response. Best case, maybe I avoid it, but I wasn't very hopeful. But I followed it to a T and I used, all those things, hyperbaric, red light, laser, peptides, shockwave. I did all my rehab exercises and, and it's now a couple of years later, I've never had surgery and I'm back to full function, full range of motion. So, these things really work. I mean, it was time consuming. Surgery is much faster. It was expensive. Surgery is probably cheaper, but, I wanted to try to do it and see if my body could heal. And certainly, as we both know, we have the capacity to heal if we get the right ingredients.
It's got to be very rewarding doing what you're doing, being able to help people out of pain. We sometimes forget, like when we feel healthy and we feel pretty good and we're able to do the stuff that we enjoy, we just take it for granted and we just go and do the stuff that we love. But the second that you have something that's hurt, like it's very crippling and very depressing in a lot of ways because you can't do the stuff that you love to do. So it's got to be rewarding for you to be able to probably troubleshoot and say, oh, like this guy needs the oxygen therapy or this guy needs the Shockwave, and you can probably help them figure out a recipe to help them get better.
Yeah. I mean, literally, we've always had a few rules in our office, but, obviously first, do no harm. Second, be as effective as we can be. But third is, I would never recommend something to a patient that I wouldn't do myself or haven't done myself or wouldn't recommend to my family or friends or my daughter or my wife, unfortunately, a lot of these things aren't covered by insurance. And like I said, a lot of these things are time consuming and costly. But when you give somebody their life back, their independence back, I could tell you stories on stories, but we have kids with, let's say on the spectrum, like autism spectrum, that say their first words, like tell their mother that they love them for the first time in our office after a session. We have people post-stroke who could feed themselves again and go to the bathroom again, get their independence, get their driver's license back again. We see, these things where it's like, it should have been impossible. But again, with the right ingredients and a little bit of time, like you start to see these recoveries and that quite honestly, Mark, that's why I do that. Yeah. That's why I've always run the office and ran the office the way we did. But it's why I've spent so much of my life now teaching other people these concepts and trying to get this stuff out there because, I can't treat that many people in my own office. I need more people, more offices, thinking and doing and putting these pieces together because that's when we could have, a really big impact, worldwide.
Can you go into that example you mentioned of that nonverbal child having their first words? Like, how long of a time was this? How old was this kid? Was this kid like 2, 5?
So, we have, literally hundreds of examples of that exact scenario. It's incredible. Gaining, for a child with autism, gaining their speech, sometimes they're completely nonverbal and we just get a few words at first. Sometimes they come in with a few words, but they're not, sentences, or they're a couple short sentences, but they're not conversational yet. Like we see language development in children on the spectrum on a regular, at this point, I make no promises to anybody, but quite honestly, these are things I expect to see change. One of the things with autism is that we know that there's what's called hypoperfusion, like not a lot of blood flow to certain areas of their brain, specifically the temporal and prefrontal cortex of the brain. And so language lives in the temporal lobe, and a lot of behavior and executive function live in our frontal and prefrontal cortex. And so if those areas of the brain aren't developing properly because of low blood flow, you're going to see a lot of symptoms in those, expressed because of that. As you drive oxygen into those areas of the brain, it takes, again, these aren't short-term effects. A standard initial protocol for somebody on the spectrum would be 40 hours over 2 months. So let's say 5 hours a week for 8 weeks is a pretty standard program. But inside that time, we see a lot of these changes. Many of these kids might do more sessions over an extended period of time mixed with other therapies. But to see even other less severe, let's say developmental delays and neurological issues that kids have, we see a lot of kids in our office, and we see incredible changes in brain improvement performances regularly. It's pretty incredible.
One more thing on this, just curious. Do these children have to maintain, let's say they gain a level of speech? Is this something that have to keep doing to get more oxygen to those areas?
Yeah, no, typically not, because when you look at the mechanisms of action, like hyperbaric, in the short term, hyperbaric will drive oxygen to that area, and actually you could start seeing some changes in performance. Mm-hmm. Long-term, hyperbaric actually stimulates new blood vessel growth. So as a result of those long-term exposures, where there was hypoperfusion, there's now entirely new capillary beds being built. And so once you pull the therapy, unless let's say in some cases there could be a toxicity issue or some other, comorbidity that's stimulating some of these issues, right? So, but for the most part, these kids, as they get certain benefits, they'll keep that'll become like the new baseline. Then we'll do other therapies or more hyperbaric over time. Then we get to a new baseline, and there's very little regression. Things that you see regression with would be something like autoimmune disease or neurodegenerative disease, where like the disease itself, this isn't a cure for that, and so the disease process may still be going on. So, but my stepdad was my second patient. So before I ever offered it to my office, my stepdad was diagnosed with MS. And so after I saw what it did for my nervous system, I love the detail of biology, but I still think very simply, right? So I was like, I had a nerve problem. He has a nerve problem. They couldn't be more different. Mine was a disc herniation. His is an demyelinating autoimmune disease. Like they're vastly different, but I said, it helped me with nerve damage and he has nerve damage. I think we should try it. And we saw incredible changes. I mean, his gait narrowed, his got his feeling back in his feet. He started walking stairs again. He saw improvements in cognition, so again, like it gets a bad name, hyperbaric, because it's like, it's a cure-all, it's a magic bullet. It's not, it doesn't really treat anything. It doesn't cure anything. But when the body needs oxygen, there's nothing else we could use. When it needs oxygen, it needs oxygen. And when it can't get enough, it suffers. And this is one of the only tools that could really make a meaningful impact in oxygen quantity and delivery to really see some of these kinds of changes that we're talking about.
It's my understanding that it's also helpful for infection. And what does it do with infection?
Yeah. So, just to summarize, so there's like 4 categories of mechanism for hyperbaric. There's mechanical effect, and that's really like hyperbaric was developed because of scuba diving accidents, decompression sickness, decompression illness, like the bends. You've heard of this probably. Mm-hmm. So what it does for, shrinking bubbles, like nitrogen bubbles, that's all dive medicine. Those are the mechanical effects. Then there's immunological effects, the effect on the immune system. There's hyperoxygenation effects, the effect on the mitochondria. And then there's all these regenerative effects, like the growth factors, the stem cells, the new blood vessel growth, all that kind of stuff. So inside the immunological side, it does 2 main things. Number one, most of the infections that really cause problems for humans are anaerobic. They don't like oxygen and they grow in low or no oxygen environments. And they build what's called biofilms around them to protect them from things like antibiotics and other things. So they have like a protective fence around them. So hyperbaric breaks down biofilms and it creates this high oxygen environment that a lot of those bacteria or other even viruses can't thrive in that environment. The other side is that it actually, your white blood cells that fight infection use oxygen, reactive oxygen species as a defense to kill bacteria, and mostly viruses. And so it's actually activating your immune system to fight infection more effectively, and it's exposing these infections to an environment that they really can't live in. And so together, we use it for a variety of infections pretty regularly.
I think it's fascinating. It seems like it does such a multitude of things. I also heard that it's great for dementia and Alzheimer's, which is something that people are trying to learn more about, because it seems like so many Americans are going to run into it because of how much diabetes we have in this country. That's it. The numbers aren't good. It seems like a lot of people, maybe like over half our population, might be heading in that direction. So it can help with that as well.
Yeah, I mean, you're right. I mean, I think it was like by 2050, it's like almost like a 1 in 2 situation in the US, which is scary. My original injury was 20 years ago. I've never had any type of recurrence from it, right? Like to your point earlier, do you have to keep doing it? You don't have to keep doing it, especially for injuries. It's like once it's healed, it's healed. My stepdad has used it for the last 20 years because he has an autoimmune disease. It's not going away. So even though we had incredible benefit, he's needed to keep at it as like a maintenance type of tool. I can't say that I've needed it, but I've chosen to keep it. I've done thousands of hours over, 2 decades of time. Part of that to me is actually because I have dementia in my family and I see what it does, not only to the person. It's almost like, I hate to say it this way, but the person even becomes unaware of how bad that they are. It's like really for the sake of their family and all the caregivers and the costs and the emotional components that come with that. Um, so my mom continues to do hyperbaric. I continue to do hyperbaric. I believe it's a preventative, quite honestly, as part of a preventative, strategy for trying to avoid dementia in the future. We do see quite a few mild to moderate, Alzheimer's and vascular dementia or other kinds of cases like that. But as we upregulate oxygen to the brain, we upregulate performance. So, oxygen, again, red light. A lot of those people I'll put either into ketosis or put them on exogenous ketones because the nervous system does really like a ketone as a fuel source in a lot of those cases, or at least in and out to try to stimulate different metabolic flexibility, for those people. Nicotine actually is a great neurological stimulant. So again, we put together, quite a robust multi-dimensional approach to dementia, but oxygen is definitely part of it.
I first started hearing about transcriptions from Thomas DeLauer.
Yep.
And, Thomas is somebody, it's an animal with working out. You got a chance to work out with him. I worked out with him. And he's kind of always on the front lines of finding out about these new companies that have cool things. But I didn't really realize that Transcriptions was the first company to put out Methylene Blue. And now look at Methylene Blue. It's so popular. It's everywhere.
It's one of those things. If you guys listen to this podcast, I'm very iffy with the supplements that I take because there's a lot of shady stuff out there.
You got to be careful.
The great thing about Transcriptions is that when people want to get Methylene Blue, usually they'll go on Amazon, they're going on these other sites. It's not third-party tested. It's not dosed. A lot of people end up with toxicity from the blue that they get because there's no testing of it. Transcriptions, they have third-party testing for their products. It's dosed, so you know easily what exact dose of Methylene Blue you're getting in each troche. So you're not making some type of mistake. There's not going to be anything in it. It's safe.
You can have it dissolve and you can turn your whole world blue if you want, or you can just swallow it. They have two different types of Methylene Blue. They have one that is, I believe, dosed at 16 milligrams, and they have another one that's dosed at 50 milligrams. So make sure you check the milligrams. I don't recommend anybody start at 50 milligrams, but the 16 I feel is very safe. You can also score the troches and you can break them up into smaller bits.
Yeah, that's what I do.
And in addition to that, on top of the Methylene Blue, they have a lot of other great products and stuff as well. They got stuff for sleep. They got stuff for calming down, all kinds of things.
I got to say, I use it about 2 or 3 times a week. I use it before jiu-jitsu. And the cool thing that I've noticed, and I've paid attention to this over the past few months, is that after sessions, I don't feel as tired. So it's almost like I've become more efficient with just the way I use my body in these hard sessions of grappling. And it's like, cool. That means that, I could go for longer if I wanted to, and my recovery is better affected. It's pretty great.
I know Dr. Scott Schur, we had him on the podcast, and he talked quite a bit about how he recommends Methylene Blue to a lot of the athletes that he works with.
Yeah.
And they're seeing some profound impacts. And one of the things I've heard about it is that it can enhance red light. So those of you doing red light therapy, or those of you that have some opportunities to get out into some good sunlight, it might be a good idea to try some Methylene Blue before you go out on your walk or run outside or whatever activity it is that you're going to do outside.
And this stuff is great, but please, first off, they have that stuff for staying calm. They have stuff for sleep. But remember, this stuff isn't a substitution for sleep. This isn't a substitution for taking care of your nutrition. This is supposed to be an add-on to all the things that we already should be doing. And it's going to make things so much better if you're doing everything else too.
And I think this is just a little different too than just adding some magnesium to your diet. I think this is a little different than... Yeah. Treat these things appropriately. Make sure you do some of your own research. But
if you're taking medications, SSRIs, you better talk to your doctor first. Don't be popping these things.
And if you're taking any medications at all, it'd be good to double, triple, quadruple check and make sure that you're safe. Transcriptions has a lot of great things that you need, so go and check out their website when you have the opportunity. Strength is never weakness, weakness never strength. Catch you guys later.
I'm curious about this because, for example, I think it was 7 years ago when we started talking about and using some red light therapy, people are like, oh, that's some quack stuff. Yeah. Now people are seeing how amazing red light therapy is. So with the hyperbaric chamber, you've been doing it for 20 years. You've seen some amazing results. Are there any theories that you can't back up with scientific evidence, but are there any like quack theories or ideas that you think this could actually be really beneficial for that just hasn't had proof yet, but because of your experience and the things that you've seen, you know that there's something there?
Well, I mean, quite honestly, so there's about in traditional medicine, which I do almost none of, um, there's about 15 indications for hyperbaric, and they're, non-healing wounds, radiation necrosis, from cancer treatment, gangrene, necrotizing fasciitis, like certain really bad infections. All the reasons that it's used in traditional medicine have to do, they're either acute, life-threatening, or limb-threatening. Like you're about to get an amputation or you're about to die. And then we use oxygen. But those mechanisms that I was describing earlier, they're the same for anybody that goes inside the chamber, whether they have a disease or not, and whether it's an on-label disease or an off-label. The diseases don't know, whether the FDA approved these conditions or not. And so almost everything I use hyperbaric for, which is also why I position it to say it's not a treatment or a cure, a lot of these things are not, they don't have the amount of research that these on-label indications do. TBI and concussion does, post-surgical recovery. It's not on-label indication, but it works in wounds, and surgery is basically a wound, right? It's wound healing. So there's reason that's very, it's an easy jump to understand that. Things like autism is very traditional, MS is very non-traditional. Crohn's and colitis, very non-traditional. There are studies on all of these, but not enough to say like, yes, we could, we are positive. But if we really just zoom out and we're like, okay, what's the nature of the issue? And or what's the nature of the goal? And would additional oxygen move the needle for this in any way, shape, or form? And for me, if the answer is yes, then we would choose to use it as part of the program. And if it's no, which quite honestly is rare, but if it's no, then, it's just not part of the program. But there's a lot of uses, they're starting to use hyperbaric for addiction, part of addiction recovery. They're seeing changes in dopamine responses and serotonin responses. Like, there's some research there. There's not a lot, but these addiction clinics are actually using it to help, shift people, away from those addictive behaviors, and it seems to be working. So there's all kinds of new uses, in mental health, especially, that haven't been explored yet too deeply, but clinically seems to be impactful.
I'm curious about this. You mentioned, for example, your back, the areas that oxygen couldn't reach as easily, right? How would potentially soft tissue work pair with hyperbaric oxygen therapy? Just because, like, when you do soft tissue work, you are, just depending on the type of pressure you use, you're getting more blood flow to the areas that you're doing that work on. And I would assume that if you're getting excess oxygen in the chamber, along with getting some type of soft tissue work, whether you're doing it on yourself or having someone do it to you, it could end up being more effective. Is that something that people do at all, or is it just?
That's definitely inside the not typical conversation, but as a chiropractor and getting into this, and everybody, all the docs in my office, we do a ton of soft, we do ART, we do Graston, like we do a lot of soft tissue work. At first, it wasn't that obvious to me either, but I'm like, why are we doing this? Well, we're doing this to A, create an inflammatory response, but B, to really drive blood flow into an area to stimulate a healing response. So we started to do, shorter exposure. So not 10, 20, 50, 60, 5 or 6 hours interspersed inside of like a soft tissue program. And we certainly, especially when they're stubborn and like not, sometimes if a soft tissue injury is responding to standard soft tissue, treatments, I don't add this just to add it. Mm-hmm. But in those stubborn cases, to really push them over the hump or to like get over a barrier. Yeah. I mean, between Shockwave and hyperbaric, those two, for a lot of those stubborn injuries, that really moves the needle for a lot of people.
Thank you so much for your time today. Really appreciate it. Where can people find you?
Yeah. So, our main website is hbotusa.com. We don't really sell, we don't offer anything, we don't sell anything there. It's like just an education website allowing people to learn more. Like, is this good for me? Is it not good for me? Should I consider it? Should I not? It's really just, what is this? And is it something I ought to look into? To learn more, we also have HBot USA has its own YouTube channel. So it's just HBot USA is the channel. I think I have 600 some odd videos on there, and 10 to 20 minute increments of just very specific topics to understand exactly how this thing works and if it might be appropriate for you. We do a lot of training and education. So I do teach these classes. So the hbotcourse.com is where, a lot of my classes live in terms of getting certified in hyperbarics, or, some of the business consulting that we do on that side of things as well. And any one of those versions also has contact us pages. If you want to shoot us an email, ask us questions. I literally do this just to get the word out, and I'm happy to answer questions as often as I can as they come through. So please feel free.
Keep up the great content on Instagram.
Thank you. I appreciate that.
Have a great rest of your day. Thank you so much.
Thanks, guys.